Imagine losing your job and your health insurance at the exact same time during a pandemic. For millions of Americans, that wasn't a hypothetical situation, that was their reality. According to Britannica and the Commonwealth Fund, the United States spends more money on healthcare than any other high-income country, about 18% of our entire GDP. Yet, somehow, even with all that spending, we rank last in healthcare outcomes. We have the highest maternal and infant mortality rates, the highest number of avoidable or treatable deaths, and some of the highest obesity rates, and millions of people who avoid care simply because they cannot afford it. So clearly money isn't the issue here. The structure of our system is the issue. And the truth is, the United States is the only high-income country that doesn't guarantee universal health coverage to its people. Universal health care is the solution, and it's not a mysterious idea. It already exists successfully in dozens of countries. Universal health care simply means that everyone has access to medical services regardless of their income, job status, or ability to pay. Most universal systems are funded through taxes, but they vary in structure. For example, one model is single-payer healthcare, where the government pays for care and the services are free when you receive them. This model is used in places like the United Kingdom, New Zealand, and Spain. Another model is social health insurance, used in Germany, France, Japan, and Switzerland, where employers and workers both pay into a government-run fund that covers everyone. These countries prove that universal health care isn't just possible, it's normal. And the United States is the exception, not the standard. My claim in this speech is simple. The United States must adopt a universal healthcare system, not just because it sounds good, but because it saves lives, lowers costs, and protects families from financial destruction. The American College of Physicians, which represents more than 124,000 doctors, has officially stated that our current system is unacceptable and needs national reform. They support both single-payer and mixed universal models as long as every citizen is covered. When some of the most respected medical leaders in the country say we need a universal healthcare system, it's time that we pay attention. The evidence couldn't be any more clearer. A major study from the Yale School of Public Health found that if the United States had universal health care in 2020, during the height of the COVID-19 pandemic, we could have saved more than 335,000 lives. That is more than 3 football stadiums full of people who might still be alive today. In that same year, the country could have avoided over $100 billion in hospital costs. And that's not even the long-term savings. The Yale researchers concluded that a single-payer universal system could save the United States over $450 billion every year because it eliminates expensive insurance overhead and gives the government the power to negotiate drug prices. Even outside of pandemic years, Americans die younger and get less care than people in countries that spend far less. The facts simply don't lie. Universal health care saves lives, and our current system costs lives. This issue isn't just about statistics, it's about us, our generations, our families, and our future. 62% of Americans already believe that the government should ensure health coverage. Many young adults lose insurance the moment they change jobs or graduate from school. We shouldn't live in a country where switching jobs means losing access to a physician. Healthcare is the number one financial fear in America. People shouldn't be deciding between buying food and paying a medical bill. A universal system would give people stability, dignity, and a peace of mind. Healthcare shouldn't be a luxury or a privilege. It should be security. It's time for the United States to join the rest of the developed world. Universal healthcare saves lives and it reduces costs, creates healthier, stronger, and a more stable society. Healthcare should never depend on someone's job, income, zip code, or immigration status. It should be a right for every single American. Thank you for listening to my call to action. And before I close, I want to leave you with one important question. Do you believe every American deserves health care or not? Your answer to that question shapes the future of this country.